This is Dr. Thomas Klein coming to you from Raleigh, North Carolina. People have been asking what these little objects are. This is my hero. This is a Greek fellow, 2,500 years ago. He lived in Athens his whole life, and his name was Socrates. And Socrates taught us how to think, and using logic, which we're going to talk about in one of our Monday night videos, because logic is very, very important. If you don't have experimental evidence in medicine, you have to use logic. And logic has been kind of trashed with the problems that we're having nationwide of people being forcefully taken off of their pain medicines for 20 or more pain conditions, which the National Pain Council is going to be publishing shortly as a compendium and guideline for doctors and for anyone who wishes to find out more about rare painful diseases. The so anyway, back to Socrates. One of his students, Plato, and another student whose name I can't remember, wrote down what his method was. And his method of thinking and using logic turned out to be Western philosophy. So people think that philosophers just kind of sit around and rub their chins, but they don't. Philosophers argue serious issues using the rules of logic, which are very mathematical. To give you an example, the rooster crows in the morning. The sun then comes up. Therefore, the rooster makes the sunrise. That's an example of false logic. But like I say, we're going to talk about that more later. And people ask what this is. This is part of a railroad layout that my grandson, who's behind the camera, and I have, but it's also for me to use to escape, which sometimes you need to do. Today we're going to talk about a patient, and we're going to use her name with permission. And her name is Debbie Heck, and she's a pain patient that I have emailed and texted back and forth for several years. She began having serious abdominal pains at age 12, and she was gaslighted and told that because of the lack of a medical diagnosis, she was accused of wanting to skip school. The radiologist tried to do an x-ray and it didn't work, and later on they found out that she had Crohn's disease, which is one of our rare painful diseases, one of our persistent inflammatory disease. And if you want to have severe pain, just have your system turn on its inflammatory processes. The pain in rare painful diseases is beyond belief. So anyway, Debbie, who was born in 1955, she went to a professional school. She was highly trained with successful piano competitions. She went to college, met her husband, went to Purdue, and they got married, and she had a family. The problem was that she continued to have this Crohn's disease, this pain in her abdomen, but then it started to generalize. And that's an old story in our business of chronic pain. This is what happens, that you start off with something, and then all of a sudden this pain starts to magnify and spread around. And it spreads around. It's so bad that you cannot function. You can't get out of bed in the morning. You can't drive a car. It becomes your total mindset. You can't function. You can't think about other things. Try to think of a time when you've had serious pain. And most everybody had some episode. But imagine what it was like when you got pain medicines. Now suppose the pain medicine was taken away, and suppose the pain started lasting 2 or 3 days. What would you be doing to try to deal with it? What if it lasted a week, a month, 6 months? Interestingly, the diagnosis of these rare painful diseases, or chronic pain, the government calls it, it has to be present longer than 3 months. So for 3 months you suffer, I guess. Who decided that? The federal government is actually prohibited by law. I've got it here somewhere. Anyway, they're prohibited by law of interfering with the practice of medicine as it pertains to Medicare and Medicaid. So anyway, so Debbie becomes a professional person, and she sets up her own business and struggles with her rare painful disease, which turns out to be fibromyalgia. Now, fibromyalgia is the only rare painful disease mentioned by the CDC because they thought it was a fake disease for women. Well, the Mass General in Boston did a study and a PET scan, which is a special kind of MRI, and discovered that people with fibromyalgia actually have brain inflammation. Your brain's in charge of everything. Your brain's in charge of your body being in pain. So she started on a fentanyl patch. Fentanyl is also a real medicine. It's not dangerous like everybody thinks. Fentanyl patch is a way to get continuous pain relief for 72 hours, which is really good because if you're taking oxycodone, you got to take them every 4 hours, day and night. So you wake up in the middle of the night, because your 4 hours is up and now you're in pain. Then you got to wait 20 minutes for it to kick in. It's just terrible. So 3 days worth of relief. So she was able to continue with her business and continue with her life. And she ended up with 14 grandchildren, 3 children. And she started to have problems with getting her pain medicines that she had been happily getting for years, allowing her to be functional. Her family doctor, and these are the people that should be describing pain meds, prescribing, said that the DEA was taking his license because 2 of his patients died from overdoses. Whoa, wait a minute. That takes court action, not regulatory action of the DEA. And they took it for a year. I mean, if you really killed people, they should take it forever. So the DEA has, as we've talked about, has regulatory function, and it's like inspecting kitchens in a restaurant. But they're using it in a way to shut down doctors who are over-prescribing, as the CDC director said, and that's the cause of the opioid epidemic, he said. So anyway, Debbie, now her doctor begs the DEA to give her a 30-day prescription along with his other patients, so they did that. And so now they had to find another doctor. Now it turns out that Debbie's professional career was that of being a physician. She had a large family practice. She treated some people with pain, and somebody treated her for her pain. So now she's cut off. Now she's back to having pain all the time, and she's concerned she isn't going to be able to run her practice. So they find a woman doctor recommended by their GP, who was taken out of action by the federal drug police, and they went to her office, sat down and talked to her, physician to physician, and this physician said, I just can't re-prescribe your fentanyl, even though you've used it for years and years, because I'm afraid that DEA will come and take my license away without a hearing, without court action. So it was time for her to go see her daughter in Florida, and they went down to Florida and they had all their records prepared, all set up to find a new doctor down there. And she began spiking very high blood pressures when she had the pain, which is very characteristic of uncontrolled pain. And she went to the emergency room, and they just wouldn't treat her with any more medicine. Now she's down there in Florida, and she has nobody to prescribe her fentanyl patches when she gets back, or down in Florida. So she tries to talk them into, they gave her one patch and a few Percocets so they wouldn't be arrested by the federal drug police. And so she started trying to taper off, and then she had this massive pain attack, which is, you talk to people with these rare painful diseases and they'll tell you what it's like. You know, they have pain all over. It's so severe, they cannot function at all. So her blood pressure spiked. Then she got one little fentanyl patch and her blood pressure came back down, and she felt better with a teeny little patch, and they just wouldn't prescribe any more for her. So she cut the patch in half, and then she had this horrible pain returning from her fibromyalgia, or what's now called central pain syndrome. And she had horrible pain, shot up her blood pressure, and developed chest pain, and died. Good evening.